Hello, my name is Sarah Whitaker and I'm a respiratory physiotherapist. In this video, we're going to talk about the importance of staying active when living with a lung condition. We'll explore what kind of exercise to do and how much, as well as the safety considerations. We'll also look at the reasons why we sometimes lack the motivation to exercise, even though we know it's good for us, and what we can do about this. We're often told that being active is good for us, but if you have a lung condition, you might wonder if it's right for you. In fact, being active can actually help to improve both your breathing and your physical and mental well-being. It improves your fitness, makes you stronger, and helps you manage health conditions and stay out of hospital. Some of the physical benefits you might expect are improvements in the strength of your breathing muscles and heart, increased muscle strength in every part of your body, improved circulation, improved bone strength, improved flexibility and joint mobility, higher energy levels, better sleep, lower stress levels and blood pressure, reduced risk of falling by improving your balance, and reduced risk of developing other health conditions such as heart disease, diabetes, stroke, dementia, and some cancers. It can also help you resist infections and help you to maintain a healthy weight. We often think that exercise just benefits the body, but it also has many benefits for your mind. It can raise your confidence and self-esteem, help your brain work better so you can learn and remember more, reduce anxiety and depression, create new social opportunities, and when you exercise, your body releases endorphins which make you feel happier and more relaxed. You might be nervous about becoming active, especially if you haven't been active for a while, but even a little physical activity is better than none at all, and it's important to remember that making yourself breathless through exercise isn't harmful. A lot of people living with a lung condition can get stuck in what we call the cycle of breathlessness or the cycle of inactivity. Increasing breathlessness and fear of breathlessness makes it harder to move around or causes avoidance of activities. As we move less, muscles get weaker, and weaker muscles need more oxygen to work. Exercise helps to break the cycle of breathlessness by making your muscles stronger and more efficient at using oxygen. Many people find that being active is more effective than inhaled drugs, and as you increase your fitness and strengthen your muscles, you should feel less breathless doing everyday activities like going shopping, doing housework, or climbing the stairs. You may even rediscover activities you thought you could no longer do. The UK government recommends how active we should be. If you're not very active at the moment, the recommendations might seem overwhelming, but by starting small and working up, you can still have a positive impact on your health. Over time, your fitness will increase and you'll be able to do more. Firstly, just try moving more during your daily life. Sitting less is one of the biggest changes you can make. Try to break up long periods of sitting and increase the number of steps you take every day. You could get up and walk around the house during advert breaks when watching television, do some housework, walk the dog, play with your grandchildren, or get off the bus one stop early. If you have a smartphone or pedometer, this can be an easy way of monitoring your activity and tracking your daily steps. Research suggests that just 1,000 more steps a day can make a difference and help you improve your fitness. Guidelines recommend that all adults should aim to do at least 150 minutes of moderate aerobic physical activity each week. This works out at about 20 minutes per day of activities or exercise which warms up your body, makes your heart beat faster, and makes you breathe quicker and deeper. Aim to get moderately out of breath. You can use the talk test to help you make sure you're working at the right level. You should have just enough breath whilst exercising to say a sentence with 1 or 2 stops. If you can speak in full sentences, you're probably not working hard enough, and if you have to stop after every word or 2 for breath, you might want to slow down a little. In addition to aerobic exercise, it is recommended that you also do strengthening or resistance exercises at least twice a week. Strengthening activities can be incorporated into your daily life, for example by carrying shopping bags or climbing stairs. You could also try yoga or use weights. If you don't have weights, you can use things you have around the house, such as cans of soup or bottles of water. Activities that strengthen the muscles in the front of your thigh, such as step-ups or standing from a chair without using your hands, are particularly recommended. Along with strength training, Balance and flexibility exercises can help you manage aches and pains and improve your posture, as well as reduce the risk of falls. Try and include some activities that improve coordination and balance at least one day a week, such as dance, tai chi, yoga, and bowls. There is no single activity that's best for everyone. Being more active could mean taking part in sports or exercise classes if that's what you enjoy, but you can also be more active just by changing your daily habits. The main thing is to choose activities that you like doing at the right level for you. Asthma and Lung UK have an exercise handbook and online resources to support you to do simple exercises at home. Activity DVDs, smartphone apps and online videos are a great way to try out different activities such as yoga, tai chi, keep fit and dancing. You might also be surprised at the number of activities where you live that are suitable for someone with a lung condition, such as walking groups, walking sports and accessible classes in local gyms and community centres. If you're not sure where to start, your local pulmonary rehab service should be able to signpost you to suitable options. As an addition to physical activity, singing can help breathing and well-being and exercises the breathing muscles. It's important to look after yourself and remain safe whilst you're being active. Start slowly and gradually build up the length of time you exercise. Warm up before and cool down after exercise. Wear loose, comfortable clothing and supportive non-slip shoes. Remember to keep hydrated. Wait for at least an hour after eating before starting to exercise. Have your reliever inhaler with you when you exercise if you use one. And consider taking this 15 to 20 minutes before starting to exercise if exercise makes your chest tight or wheezy. If you normally use oxygen, even just for some of the time or overnight, you can use it at your regular setting when exercising. Avoid exercising in extremes of temperature or modify your level of activity. Use the talk test to get the level that's right for you. Do not exercise if you are feeling unwell. And for patients with diagnosed heart problems, if you have a GTN spray, have it with you when you exercise. Please stop exercising if you experience any sudden unpleasant symptoms, including chest pain or tightness, feeling dizzy, nauseous, clammy or cold, feeling increasingly wheezy, or getting sore joints or muscle weakness. Get advice from your GP or healthcare professional if you get any of these symptoms, and in an emergency, call 999. We know that fitness and strength improve with regular exercise and maintains if you continue. However, if you stop exercising, fitness gradually declines back to the previous level. Sometimes it's hard to motivate ourselves to take part in regular physical activity. Barriers can include time, energy, motivation, cost, illness or injury, transportation, weather, and social environment. It's worth identifying any barriers that resonate with you and exploring ways of overcoming these. For instance, if lack of energy is a barrier, schedule physical activity for times in the day or week when you have the most energy. Try keeping a diary for a few days to help you identify when this would work best. Or if lack of motivation is a barrier, plan ahead, making physical activity part of your schedule and write it on your calendar. Sometimes joining a class or inviting a friend to join you helps you commit. If weather, cost or transportation are barriers, spend a little time developing a set of regular activities that are always available, such as stair climbing, exercise videos, or dancing to music at home. Another thing that can help to motivate us to take part in physical activity is to associate it with a personal goal. Goal setting is the process of taking active steps to achieve a desired outcome. Start by identifying what you want to achieve. The goal needs to be specific, measurable, achievable, relevant or realistic, and time-based. For instance, rather than just saying that you want to walk further, try to make it a SMART goal by setting something like, in 6 weeks' time, I want to be able to walk half a mile to the doctor's surgery. Then think about what you'll need to do to achieve this goal. That might mean setting mini goals for each week to monitor your progress. Sometimes we might not achieve a goal, but this is an opportunity to reflect and explore the reasons why it didn't happen the first time. Focus on the positives, learn from your mistakes, and reset and realign your goals. Perhaps the goal wasn't truly realistic or relevant enough, or perhaps you need some additional support to achieve it from friends, family, or healthcare professionals. Physical activity helps you take back control, be more independent, and can help you live well for longer. If you need support to increase your activity levels, speak to your GP or healthcare professional.